Hi, and welcome to LifeVac. My name is Jane Mascola, and I want to thank you for joining me on the following video demonstration on how to use LifeVac. The purpose of this orientation is for you and your family to become more confident and comfortable in using LifeVac should the need arise. I actually was the first person to ever receive LifeVac for my family. Both my mother and father have multiple sclerosis and experience difficulty with swallowing. I also have a 3-year-old daughter. As we all know, LifeVac is intended to save the life of a choking victim. However, as I have experienced firsthand, it has a significant additional benefit, and that benefit is the daily relief and peace of mind that it has offered myself and my entire family. Please take the time that you need to watch the following demonstration on exactly how to use LifeVac if a choking event were to occur. Please take the time to watch it as many times as possible, and our hope is that you not only are confident, but that you may achieve that same daily relief and peace of mind.
The following demonstration is conducted strictly for educational purposes only. Keith Johnson, MD, is a medically trained healthcare provider, board certified in both pediatrics and internal medicine, and is certified in the current ACLS protocol. This is strictly shown for demonstration purposes only and should not, under any circumstances, be duplicated by anyone for any reason. LifeVac recommends certified training in ACLS protocol, including choking protocol and CPR.
The LifeVac is a new medical device which is designed to be used by any lay person in a medical emergency for young or old when you've lost an airway to choking. It's simple to use. Like any medical device, you really should try to get familiar with it before you use it. Learning how to use it in a time of emergency is the wrong time to learn. Learn how to use it before that. In 3 or 4 minutes, you will become proficient with this. Using her thigh or your own thigh, push it, pull. You'll feel the suction. That shows you that creates a good seal. Without that, it won't work. If the person is awake and still coughing or speaking, leave them alone. Let them try to clear their own airway. Can you speak? Okay. So you've identified a person as having trouble getting air into their lungs. You don't have much time. The device is like a standard ambu bag face mask in all ambulances, ERs. It's sealable, fits almost any size. You don't just slap it on sideways or anywhere. The apex of the mask is placed on the forehead, go down to the area that's called the glabella, between the eyebrows, pushing down on the face, holding the top and bottom of the mask with your 2 fingers, and the jaw with your other fingers, creating a tight seal. Push down hard, pull up hard, look for a result. Did it work? Immediately roll the person on their side. Is there a foreign body that is lying in her mouth that if she takes a gasping breath, it's going to go flying back into her airway? Is she going to throw up? If she's breathing, leave her on her side. Let her catch her breath. If not, roll her back and repeat it. Same way. Start at the forehead, coming down. Seal it. Sometimes the mouth will be so shut or closed, you're going to have to use another finger to push in between the gum line, the teeth, to open it. Push hard, pull. Again, look for a result on the side and just take a second to watch. Is she gasping? Typically, a person will take a breath, or they'll cough, or they'll throw up. Another reason to have them on their side. You can use it as many times as you can until EMS arrives or other trained medical professionals. LifeVac is simple. 1, 2, 3. 1, place the device on the patient. 2, compress it. 3, pull hard. It's that simple.
We hope you have enjoyed the demonstration clip on how LifeVac would be used in the event of an emergency. Now is your opportunity to remove and review all of the enclosed components of LifeVac in a non-emergency setting. Please review this material and all of the components thoroughly and practice as shown in the following clip. It is recommended that you practice in a non-emergency setting as many times as you may need in order to feel comfortable and confident with LifeVac. Please enjoy the following step-by-step instructions prior to a choking emergency. LifeVac recommends certified training on ACLS protocol, including choking protocol and CPR. As mentioned earlier, LifeVac can offer a significant additional benefit of daily relief and peace of mind. Now you may feel more secure knowing there is an additional option readily on hand if a choking event were to arise. When you receive your LifeVac kit, please familiarize yourself with all of the contained components. Your LifeVac kit contains your LifeVac unit, a test mask, an adult mask, and a child-size mask. It also contains literature with step-by-step instructions for your reference. Take the mask marked test and remove the protective covering. Then insert into your LifeVac. Twist and apply pressure until mask is fully in unit. Hold unit by handle in your dominant hand and push against your opposite hand, then pull away. Repeat this step as many times as you may need. Now find a clean, firm, smooth surface. Hold handle with dominant hand. Hold mask as seen in the demonstration video. Compress and pull slowly. Get a feel for the pressures exerted. The practice of holding the mask firmly and creating a good seal is critical. Now compress slightly quicker and pull quickly. You should get a good feel for the suction force and why it should be effective. Repeat as needed while referring to the demo video or from your hard copy laminated orientation that was enclosed with your LifeVac. Become as comfortable as possible with your LifeVac. Now remove the test mask and dispose of properly. Replace all items back into the LifeVac container and mount or store your LifeVac in an easily accessible, cool, dry location. As you know, LifeVac can be used on almost all age groups, including oneself, the elderly, and children. Please watch the following demonstration of LifeVac being utilized on oneself. If you are alone and begin choking, please follow all ACLS protocols first. If unsuccessful, you may use the LifeVac in the same manner as you have learned while practicing on your countertop. Place the mask over your nose and mouth and create a seal by holding the mask firmly. Depress the handle in a deliberate downward motion and then quickly pull up or away from your face. Please watch the following use of LifeVac in a mock or example of a choking emergency with a dummy. Please note that the following is for your educational purposes only, and LifeVac recommends that you practice according to the previously described method on your hand or tabletop. LifeVac can be used by practically all ages, including the following men and women. LifeVac recommends certified training in ACLS protocol, including choking protocol and CPR. As noted throughout the video, as well as on your enclosed LifeVac literature, please follow all ACLS protocols first and call 911. If all ACLS protocols fail, proceed with LifeVac. After you've inserted the mask into the unit, place the unit over the mouth and nose. Hold the mask in place with pressure, creating a seal, and depress the handle. Now, quickly pull the handle upward while holding the mask in place. Please refer to your enclosed LifeVac literature should you have any questions or need further clarification. Also, please note that LifeVac is specifically designed with a valve in place in order to have no air exerted through the mask when the unit is compressed. This patented designed valve therefore prevents air from pushing food or objects downward. In addition, the seal is not composed of rubber, therefore it will not dry out. This then creates a one-way suction intended only to extract the lodged food or object. Now that we know that LifeVac does not push air down through the mask, and rather only suctions air upward through the mask, extracting the lodged food or object, it is critical to highlight the importance of creating a tight seal, depressing the handle firmly in a deliberate downward motion, and pulling up the handle quickly in order to effectively clear the obstructed airway. It is just as important for you to know that the negative forces generated by LifeVac, when used properly, are quite significant. As you see here, the LifeVac is placed on a bowling ball. Just as seen with the previous demonstrations, one hand is holding the mask firmly against the ball, creating a seal, while the other hand is holding the handle. Depress the handle firmly in a deliberate downward motion and then pull up quickly. The significant suction force of LifeVac can lift up a bowling ball. This should provide you with the confidence in the power of your LifeVac. Now let's see what happens when the steps are not followed as described. If a proper seal is not created, if the handle is not depressed firmly, or if the handle is not pulled up quickly, the bowling ball will not be held up. In other words, no suction force was created. This is not an effective use of the LifeVac. As you have seen throughout this video, there is great importance in following the simple steps of LifeVac. 1. Place mask over nose and mouth. Hold mask with one hand, firmly, creating a seal. 2. Depress handle firmly in a deliberate downward motion. And 3. Pull up handle quickly.
Thanks for watching this demonstration. I hope you and your family now feel confident and comfortable with how to use LifeVac should the need arise. On behalf of LifeVac and as the first recipient of the product, we want to welcome you now to the LifeVac family.